Hi Janelle, how are you?
I'm great. How are you?
Good. Thank you for coming in. It's great to see you.
Great to see you.
I saw in your file that you're coming in for some head and back pain. Could you go ahead and just describe that a little bit?
Yeah, I just have some pain that's seems to start at the top of my head, radiates down to my neck and my shoulders as well.
Okay, so that's top of the head, and it radiates.
Yeah.
Is it ever a throbbing sensation, or just kind of radiates down?
Kind of just radiates, and it's pretty consistent.
Okay. And then where does it stop, would you say?
Maybe about like my mid-back.
Okay. When did you start noticing these symptoms?
It's been some time.
Oh, okay. Weeks, months?
Maybe even the last couple of years.
Wow, okay. So since this has been going on for the last few years, can you explain to me, is there any pattern you notice of when it gets really bad, say at night, in the morning, after eating or drinking caffeine?
It's funny you say that because I think when I do drink caffeine, it happens, and I think when I'm stressed, it definitely...
Sure. Yeah. Caffeine and stress can definitely activate the nervous system, so it makes sense that your body would react and you would feel those symptoms a lot more during those times. Do you have any prior history of any nerve damage, nerve pain?
Not that I know of.
Okay. Has it affected your ability to focus and do activities?
Yeah, it can be a bit distracting. I definitely need to just relax when it's happening as much as possible.
Okay. Is it worse whenever you reach and exert yourself physically, say when you exercise or lift heavy things?
Yeah, I mean, I wouldn't work out if I were experiencing it.
Okay, I'm so sorry to hear that. Okay, so on a scale of 1 to 10 right now, how would you rate the pain?
I would say today it might be maybe like a 5 or a 6, kind of in the middle.
Okay.
Crazy.
And at its worst, what would you say it gets, like when it gets really bad?
Well, I would say I get up to like an 8. Yeah, probably about an 8. I don't think it's too excruciating.
And has it impacted your ability to sleep?
Sometimes.
Okay, I'm really sorry to hear that. Any family history of this similar type of pain? Do you have family members that experience this, or is it just something you've noticed?
Not necessarily this particular kind, but other kinds of migraines.
Sure, okay, migraines. Do you get migraines?
Once in a while, yes.
Okay.
Usually around my menstrual cycle.
Okay, and what have you been doing to help the pain? Have you been taking any medications over the counter? Or?
I try to stay away from painkillers. I do take ibuprofen sometimes. I try to take magnesium, things that are more
That's really good.
Ashwagandha,
That's great.
to de-stress.
We're gonna definitely assess and give you a little bit of treatment here. I would say in terms of supplements, adding fish oil can definitely help. It can really help the joints. So just keeping that in mind, it might have a subtle effect. Okay.
Yeah.
Well, if you don't have any other questions, I think I know all I need to know. I'm going to start by taking your vitals.
Okay.
Then I'm going to just do some very light joint assessments, palpate the area, and I do have a chiropractic activator tool I want to use on you today to kind of reset the nervous system and your musculature. Okay. Great. Okay.
Thank you.
Okay. Any blurry vision, or has it affected your eyesight at all?
I don't know that it changes my eyesight.
That's a good thing. That's really good. Okay, I'm just going to listen to your heart and your lungs. So just breathe normally for now. Okay, heart rate sounds normal. Okay, I'm just going to flip this over and listen on the bell side or murmurs. Okay, your heart sounds healthy, so that's good. Do you have a job that has you like standing in the same position or for a long period of time, like an office job?
No, I move around.
Okay, all right. All right, well, next I'm going to go ahead and get your blood pressure. Okay, and your legs aren't crossed, so that's good. Okay. You're at 110/72, so that's excellent.
Okay.
Slide that off. Great. And just going to take your oxygenation of your index finger. Okay, your heart rate is 80 beats per minute. Oxygenation is 99% of room air. So that's all good, normal so far. Okay, to remove that. And I'm going to take your temperature. Okay, 97. Perfect. Okay, so I want you to just scoot towards me and face me just a little bit more. Perfect. I'm going to have you just pull your hands forward like this. I'm just going to do some myotomes and test your joint movement. Try to open your arms as hard as you can go. Good. Okay, good. And try to bring them closer towards yourself. Good. Now try to lift them in the air. And lower. Good. Was that painful for you?
A little bit on my right side.
Okay. All right. Go ahead and relax. I'm going to just palpate your head next, and we're going to do the same thing. So try to turn your head to your left. 3, 2, 1. Good. Nice and strong. To your right. Good. Now try to look up at the ceiling. I'm not going to let you do that. Good. Now try to touch your chin to your chest. Okay. Good reactions. Try to raise your eyebrows for me. Okay. Good. Raise them all the way. Now try to lower them. Okay. All right. You mentioned the head pain. I'm going to do a swab just to test for some viral infections. Okay, so I'm going to go in your inner cheek. If you could open your mouth. Perfect. Going to send that to the lab. Okay. And before I examine your shoulders and back, we're going to do a quick reference, a baseline test for sensory receptors on your face. So this is sharp and cold. Go ahead, close your eyes. Okay. This is going to be a cold sensation, and this is sharp. So go ahead and say cold and sharp, depending on which one you feel, okay?
Sharp.
Good.
Cold.
Good.
Sharp. Sharp. Sharp.
Cold. Good. Cold. Okay.
Sharp.
Cold. Cold. Cold.
Sharp.
Good.
Cold.
Excellent. Now just using the cold tool, tell me which side of your face you feel the sensation on, your left or your right.
Right. Right. Left. Right. Right. Left.
Awesome. You passed that with flying colors. Okay. So for this next portion, I'm going to have you stand up and I'm going to just examine just your upper back, okay?
Okay.
So I'm going to do a visual examination of the back. I'm going to measure for symmetry and palpate. I'm going to move your hair out of the way just so I can visualize it better. Is that okay?
Yep.
Just going to brush it and put it up with a clip. Not a lot to detangle here because your hair is kind of perfect.
Thanks. I brushed it before I got here.
No, okay. Just for me. All right. Okay, taking a light here to inspect the skin. Just looking for any signs of redness. A few little tiny spider veins, but that's normal. Other than that, your skin looks very healthy. It's very well perfused. Don't see any purpling of the skin or anything like that. Okay. Okay. Alright, I'm going to go ahead and just palpate and feel the skin now with my hands. Now, do you feel the pain more on your left or right side, or is it pretty equal?
More on my right.
On your right side? Okay, I am definite buildup of tension right here, right along the cervical spine, but kind of adjacent to the trapezius muscles. Right here on the thoracic spine. Just right here, just a lot of tension. Do you feel pain when I push here?
Not like...
Right now? Okay. That's good. I'm not noticing any signs of scoliosis or lordosis. So that's good. Your spine looks to be right in the center. And let me know if you feel any sudden pain. Okay, we're going to do kind of similar to what we did with your arms. You're going to try to turn your head, turn your whole upper body this way, and I'm going to be pushing against you on this side. 3, 2, 1. Nice and strong. Good. Let's do the other way. 3, 2, 1. Good. Now try to turn forward like this. 3, 2, 1. Okay, good. And the other side. 3, 2, 1. Excellent. Just going to make note of that here. Okay, I'm going to do some percussions just very lightly. Definite ball of tension right here. Okay, go to the other side. Not noticing any edema, no fluid retention. It's just muscle.
Yeah.
Here. Just a buildup of tension. Okay. Just going to do some quick measurements of both sides to just look for symmetry, see what's asymmetric, so I know where to zero in on, but I'm pretty sure it's going to be right in this upper right area. Okay. That is 6.5 centimeters. Okay, on the top of D1. Let's start here. This side, it is only 6. You definitely have more surface area on this right side. Okay. Okay, becomes more symmetric in the center. So around T6, you have perfect symmetry. About 21 on each side. Okay. Okay, it's 22 here. 22, perfect. 22 and a half. And 22 and a half. Okay. I like your tattoo right here. It's really cute.
Thanks.
Yeah. Okay. 6 3/4 here on this side. 7 3/4. Let's see if that's the same. A little bit less on the left side. Just gonna make note of that. Okay. Going over from your shoulder here. Doing really good. It's 5 centimeters. Okay, 5. Great. Okay. So I'm going to have you just slightly turn this way. Okay, that's perfect. Okay. We're going to do the cold and sharp test real quickly before I just apply some very light treatment here, and I'm going to start on the cervical spine. But first, let's do sharp or cold, okay?
Okay. Cold.
Good.
Sharp. Cold. 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 Sharp. Sharp. Cold. Cold. Sharp. Sharp. Cold. Cold.
Good.
Sharp.
Good.
Sharp.
Good.
Cold. Sharp. Sharp. Cold.
Okay. Great. Then I'll apply just a little bit of therapeutic oil to the cervical spine here. Okay. Just to loosen the joints. Okay. So we're going to start with a double-headed pressure point on both sides of the spine here. Okay, you're going to feel a light pressure and kind of a gentle reset. Okay, let me know, it should not be painful at all. Just focusing here on the top of the cervical spine. Okay. Sorry.
It's okay.
Okay. Okay. And before we lay down, I'm going to just do a brief test with a tuning fork. Say no.
Now?
Okay, that was a little delayed.
Now?
Okay.
Now? Now?
Okay.
Now?
Okay. Okay, I'm going to do more of the activator tool. I'm going to have you lay down on the massage bed though to get you nice and comfortable so I can apply different pressure points and settings, okay?
Okay.
Alright. Alright, so hopefully this is a little bit more comfortable for you. Just going to be slightly with my hands, taking off my glove here. I'm going to be gently touching the area. And in addition to the oil, I have some frankincense essential oil. I'm just going to be just putting it gently on the skin, okay? Focusing on this upper right area. Okay. Following up with a little bit more oil. Okay. Okay, and changing to a single activator head. Okay, you're just going to feel a gentle pressure here. Going to go along both sides of the spine and then out to the shoulders. Let me know if you should feel any pain. It should just feel like a gentle shift. Okay. Take a deep breath in as I just focus on this upper right area. Deep breath in and out. Going out to the sides. Okay, I'm gonna go ahead and listen with the stethoscope just to hear the sounds of the back, see if there's any rattling, anything going on with the muscles that I can hear to better inform me. But I really do think it's just that buildup of tension right here. Okay, it's gonna feel a little bit cold. Deep breath in and out. Good. Don't hear anything abnormal. The joints sound healthy. Okay. I'm going to be using some sensory brushes just to activate the senses on the top of the back. awakening the dendrites on the top of the skin. We hold our back in certain positions for a long period of time. We can lose our ability to feel senses, which can further tense up the muscles. So if you feel a goosebump-like sensation right now, that's a really good thing. It's just another way to attack the pain. Your skin is really soaking up the oil, which means that it gets slightly dehydrated. So it's just good to keep applying moisture. The back is not an area that we will a lot of times give moisture to. It's just hard to reach. So I'm just trying to nourish the area. These are all natural oils. This has eucalyptus, arnica gel, and chamomile. You shouldn't feel painful. Just a little bit more. Okay, switching back to activating. Remember to breathe. Okay, you're doing really good. I'm already seeing some of the swelling going down. Okay, I'm just gonna smooth it in. motion, just a little bit of sensory work here. And gently working out some of these knots. Okay. Next, I'm going to use a vibrational tool. You don't have to tell me when it stops again. I'm just going to be applying it to the shoulder blades here. It's going to really kind of reset the nervous system area and the blood flow along the shoulder blades. Okay. Okay. Just gonna add a little bit of water just to hydrate the area. Okay. More points to catch here, and then we'll have you go ahead and lay base up. Okay, I'm already seeing some of that area begin to go down, so I'm really pleased with our progress. Before we go, I'm going to have you flip over. I'm going to focus on the shoulders and just give you a hand massage in the upper chest, okay? Okay, yeah. Yeah, just close your eyes. Okay. We're going to do another round of sharp or cold, just to make sure that you're not having any numbness in the front area, okay? So go ahead and say sharp or cold, depending on which one you feel.
Sharp.
Go ahead. Cold. Good.
Sharp. Sharp. Cold.
Good.
Sharp. 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 Cold. 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 Sharp. 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 Cold.
Okay. Very good. You're gonna feel my fingers just massage along the jawline, okay? If anything comes up as very painful, let me know. And let me know when the sensation stops. You're going to feel that vibration again, okay? I'm going to be placing it on top of the head, the sides of the head, also your shoulders. On the head, it's going to feel a little funny. It's going to feel like it's kind of resonating all over your skull, so just enjoy that.
Okay.
Let me know when it stops.
Now.
Good.
Now.
Good.
Now.
Good. On your chin.
Now.
Good.
Now. Now. Now.
Good.
Now.
Yes. Okay. Okay. I'm going to be using the tool here on the sides. So just turn your head now gently to your side. Good. Just going to be using a mini tool just to activate the pressure points along the ear. Okay, gently turn your head this way. Good. Okay, and back up to center. Okay. Okay, Janelle, that concludes our session for today. I really focused on the upper right section of the back. I think you're going to really experience some relief in the next few days. You might feel sore tomorrow. If it feels like it's getting better, I'm going to give you a follow-up call and we can talk about it and our next steps, okay?
Awesome.
How are you feeling right now?
I feel good. I feel relaxed.
Good. Well, thank you for coming in, and we'll see you next time, okay?
Thank you so much.